Welcome everyone to another wonderful episode here at Jaws Podiatry. This is a great case that I'm going to present. It's a case update. Why? Because a lot of people are seeking solutions for not only what we call the shrimp, right, the hammer toe of the fifth toes, but also unsightly corns, right? A lot of people are not happy with the appearance of these corns. They can be, very, very dark, hyper pigmented, or really, really light, hypopigmented. So Caesar, come around here. Let's just take a look here. So this particular patient presented with bilateral left and right, okay, hammer toes of the fifth toes, and basically the toe was sort of like that, right? It was a hammer toe. So it's been 6 days since we performed minimally invasive surgery, okay? And what we see here, okay, just to give everyone a little bit of background, this was performed in our office-based surgical suite under local anesthesia. The patient was awake. We do not use any pins, plates, or screws. So right now, everyone can see the little steri strip here. And that's exactly, believe it or not, that's what's holding everything in the proper anatomical location. As everyone can see, the toe is very straight. So it's not hammered, right? It's not like this. It's not crooked on its side. We have basically rotated the toe into its normal position. So we did that for both the left and the right. We're going to continue. We're going to continue doing these very intricate splinting techniques during the course of the next 2 to 3 weeks. The patient was able to walk out of the office the day of the surgery and has been walking without a problem. The other procedures that we did perform, today we removed the sutures. Believe it or not, there was one little suture right here. The patient had a very, very unsightly corn there. It's already, we were just talking about it, it kind of just, they're already fading away. So we basically just shaved the underlying problem there, kind of make believe it's a pebble underneath the skin. We were able to, and that's a structural problem at the core. The symptom is the unsightly corn, and we basically shaved that down. And we also went ahead on the left, on the right foot, on the right fourth digit, pretty much the same thing. There was one little suture here. I don't know if you guys can tell there. I want everyone to see it. There's a little hypo, right, pigmented lesion there, and it's with a little bit of time that's going to disappear. And right here there was one little suture here, Caesar, bingo, right there. And then this one is already definitely fading. Am I correct? Correct. Yeah, this one's already fading after 6 days. So the patient also had another unsightly corn there. Unsightly corns are unsightly. They're ugly. What can I say? And a lot of people, battle these ugly corns or calluses, but there are long-term solutions, minimally invasive long-term solutions. So, the key here is education, and that's exactly, what we do. We try to educate the world that, minimally invasive solutions do exist, and aesthetic solutions also do exist. So I think this is a great case. It's only been 6 days. How do you feel?
Great. Thank you, Dr. Wagner.
I'll send you the check. On a serious note, it's been 6 days. On a scale of 1 to 10, 10 being the worst pain?
I would say 9.5. No, sorry, that's 10 being the worst pain. I'm at like maybe a 1 or 2 discomfort.
So one or a 2, 6 days. Minimal swelling. Patient's doing great, but I also like to be very transparent. Every patient is different, right? So it really depends on a case, patient to patient basis, case to case basis, right? But
overall, it was a great experience. Very minimal discomfort and pain during the procedure, and the healing process has been wonderful. It was better than my expectations. So
excellent. But I want to note of relevance is, it is an investment, right? Yeah. And patients need to be compliant. That's critical.
Compliance is 100% important in healing. So yeah, I agree.
Super. I'd like to take this opportunity, number one, to thank the patient for allowing us to do this, the video. As always, Caesar, thank you very much. We will continue to do what we do, which is to educate the world one foot and one toe at a time. Have a wonderful day, everyone.